Okay, this is Dr. Sohrab. I am the on-call doctor of this clinic today. Uh, am I talking to Mrs. Sarah? Is 25 years old.
Yes.
Okay, how are you, ma'am?
I'm good.
Okay, so ma'am, how can I help you?
I'm nurse and accidentally I pricked some needle injury and my patient was HIV the positive. That is the main issue and I'm really the stressed about that. What will happen to me?
Oh, so sad, ma'am. I'm extremely sorry to hear that. You have a history of needle stick injury, right?
Yes.
Okay, ma'am. So, how many days it will happen?
It's just before the 4 hours before this happened that.
Okay, okay, ma'am. I'm so again extremely sorry because it is too much hard for you. So, ma'am, can I ask you some question regarding this condition?
Sure.
Okay, ma'am. So, ma'am, could you tell me what happened before this stick injury, needle stick injury?
Okay, I went to my the patient to inject some of the medicine, but trying to the injected this the medicine that accidentally this is the prick in the index of the finger. That's
Okay.
all.
So, ma'am, patient is known case of any infectious disease?
Yes, she HIV positive.
Oh, so sad, ma'am. So, ma'am, could you tell
Oh,
me, did you wear any gloves during your procedure?
yes, I did.
Okay, good. That's good, ma'am. So, ma'am, what's happening during this procedure? Is this needle is wide or narrow? Or which type?
This is a narrow or the 10 cc of the injection at the needle. This is the simple the narrow needle.
Okay, ma'am. Could you remember, ma'am, that was it deep or superficial injury?
No, this is the just the prick in the skin. That's all.
Okay,
It's not the go the too much deep.
okay, ma'am. Got it. So, did you squeeze the site of injury, ma'am, after in the?
No, no, no. I didn't do that.
Okay, ma'am. Did you wash your hands with soap or alcohol? Anything else?
Yes, I immediately I give the some of the alcohol that is called Hexisol over my finger.
Okay, ma'am. That's good. So, ma'am, could you remember any immunization history against any infectious disease like hepatitis B or any types of infective?
Yes, I fully vaccinated with the hepatitis B.
That's good, ma'am. That's good. Okay, ma'am. It's I know it's too a stressful condition for you. I'm stressful condition for you, but ma'am, we have a plan for your management purpose. Uh, okay, I can share you more information regarding needle stick injury if you allow me. Can I? Can I, ma'am?
Come again.
Okay. Okay, I can. Okay, ma'am. So, ma'am, needle stick injury may carry some risk of infective agent like HIV or hepatitis C virus or hepatitis B virus, blah blah blah. So, but I want to reassure you that the infection chance of in case of HIV is very much low. It is nearly about 0.3%. And in case of hepatitis C, it is 3%, and in case of
Okay.
hepatitis B, it's 30%. So, no
Mm.
need to be worried. So, a large number of medical staff had a history of needle stick injury, but with a very limited case of infection. Okay, ma'am, got my? Are you getting my point?
I'm getting, I understanding, but are you sure? Already, I have already. There is some is coming out while this needle the prick into my the finger. Are you sure I'm not going to get infected with HIV?
Okay, thank you, ma'am, for your concern. Ma'am, first of all, we're going to do some test. before our confirmation. And because it's an accidental injury, for this reason, we need to write a incidental reports. Okay. And as soon as possible, I'll give you a prophylaxis because you have a history of known case of HIV patient or the needle stick injury. Okay, ma'am. So another point is, ma'am, in the time I'll check your blood for HIV or hepatitis C or hepatitis B infection on your body, yes or not. But before we test HIV, we need to consent from you for HIV test. Are you getting my point, ma'am?
Yeah, sure. But I know that some of the medicine, can I get some of the medicine for that? That my this is the kind of the HIV virus is not going to just spread all over my the body.
I got your point, ma'am. I appreciate your concern. Ma'am, first of all, we need to exclude the HIV virus present or absent. Okay. For this reason, I do some test. And the test result will be released after 24 to 48 hours. And ma'am, it will be totally confidential, absolutely confidential with you and me. And I will give you the result with face to face, not by any mail or telephone. Okay, ma'am?
Okay, I got it. I
Oh,
got you now.
all right. So, ma'am, for your management purpose, so we make I will refer to you a multidisciplinary team or from an infectious disease doctor and occupational health workers, workers to give you the proper plan of care and follow up. Okay, ma'am? So,
Uh, okay, I got it. Okay.
okay. So before getting the results, you need to seek any medical attention, or when you'll find any fever, or you have to show any skin rash, or feel any lump or bumps, or you have find that you have lose your weight, then you just seek medical care at once. Are you following me, ma'am?
Okay, I got it. But I have the question. I
Yes.
can continue my work.
Okay, ma'am, I will explain you and clarify this of your concern, ma'am. So first of all, before your job life modification, continue your job. So, ma'am, first we need to be sure that you have positive or negative results. Okay. For this reason, I'm going to check your HIV status. Okay. Sometimes, ma'am, result might be positive, or sometimes it may be negative. Sometimes we may have found the results false negative, or maybe it would be false positive. Okay. So before confirmation, I'm give you some information to maintain uh, on your job. Okay, ma'am.
Okay.
So, ma'am, if the test is negative, and I will do a repeat test after the 3 months to be sure you are completely free from this virus. Okay. So what we'll doing within this 3 month period? So first, we cannot do any medical procedure or direct contact with your patient. Are you getting my point, ma'am?
Okay. Okay.
Okay, so
Yeah.
then I'll inform our occupational health worker, and I will attest to you our occupational health worker uh, to provide you to provide you with office work, not like direct contact with the patient or do any procedure which can injurious or harmful for another person. Okay, so ma'am, in this I would like to share more information, information like uh, before completely confirm you have HIV or not. In this period, you didn't give any blood transfusion and the patient, and you also cannot use share razor or mouth brush. It must be on your personal. Are you getting my point,
Okay.
ma'am?
Yes. Yes.
So, ma'am, I need to ask some personal question. Can I?
Yeah.
So, ma'am, do you have any partner?
Yes, I have.
Okay, okay, that's good. Ma'am, have you any plan regarding your family or plan of for
Yes.
pregnancy soon?
Yeah. Yes.
Oh,
2 to 3 months later, we'll decide. We
that's
have the plan.
good. Ma'am, but that's good, ma'am. But I would like to inform you that in this period, you need to save sex before confirming, until confirming your HIV status. Okay,
Okay, but I got it. But I have a partner, and we're planning to getting with the married or started out the family as soon as possible. But right now, I'd like to request you, this the news should be between us. I don't want my the partner to know about that already I have this the kind of the incidents.
okay, okay, got it.
Okay.
Got it, ma'am. Got it. I appreciate your concern, ma'am. But still,
So
yes,
okay,
ma'am.
so my partner is not going to know about this. Is it? I like to make the assure these things. Okay, doctor.
Okay, ma'am, I got your point. Actually, I'm extremely sorry, ma'am, to hear that that you are needle-stick injury with a known case of HIV again. So, ma'am, actually, it's a communicable disease. The disease HIV can transmit it some sexual intercourse and needle-stick injury or like that. For this reason, I'm suggesting you to make a safe sex until confirming you are completely virus free. Okay. So
Yes, but
this is
uh,
what
but
we
I don't want to let him know that already I have this is the kind of the injury I faced, because my relationship will be the falling in the part for that. So he must be unaware about that.
ma'am,
So uh, I'm a little bit scared. Are you going to tell my the partner that our the conversation?
Uh, first of all, ma'am, it need to be confirmed your HIV status. I think that you don't. I think that you share if there is no any information barrier or any if there is no any harmful situation in your personal or conjugal life, you might be share this with your partner. Otherwise, it would be confidential, ma'am.
No, I just want to make our relationship as just with before. There is nothing, any kind of the trouble, any kind of the barrier shouldn't be the present between the us. It must be
Yes, ma'am.
you if have to the reassure these things for me. This is very essential for me right now. I'm really anxious right now. I don't care about right now my HIV the positive or not, or needles prick the injury. I'm really the care of about my relationship. It's now in danger. So if my the partner ever know that I have an exposure of the HIV, my relationship will be the falling off, and I don't want to be this is the kind of the situation.
I got
Okay.
your point, ma'am. I got your point, but I'm really I know that you are this news is too much hard for you. But sometimes some medical condition we try to maintain uh, some procedure or some barrier. Uh, we cannot share. We cannot run as usual our daily life. So in this situation, because the patient has HIV positive, you have the needle stick injury, so you might be have HIV positive, might be. But if you have HIV positive, this virus will be transmitted from to your partner. So it will then again create another problem. For this reason, it's my suggestion to you, just make a safe sex until you have completely virus free. It would be better, ma'am. Are you getting my
Okay,
point?
I'll try, but I don't want to disclose this the conversation to my the partner. I don't want. Really, I don't want. You have to assure me that you're not going to disclose our conversation to my other partner. This is my request.
Oh,
I'll
okay.
do that. I'll do that. All the protection I'll take. But you can't disclose these are the things. I'll give the protection.
Okay.
So I'll about the really the assure that my other partner not the going to be infected from me. But these
Mhm.
things shouldn't be the disclosed from you.
Okay, I got your
Is it
point, ma'am.
okay? Is it
Okay, ma'am. We have the medical legal ethics that we cannot sometimes we cannot disclose patient information from another person. In this situation, this is the communicable disease. Okay, ma'am. Sometimes it may be infected to the other person. Uh, Sometimes we need to aware another person.
Yeah,
Uh,
I got it. I got it already. You told me, but I can assure you, I can give you all the my guarantee. I'll take all the short of the prediction that this, if
okay.
I have the HIV, that my the partner not going to be have the from me, but I don't want to disclose these the things to my the partner, and our conversation must be confidential. This is my request. That's
Sure,
all.
ma'am. We can maintain it. Okay, absolutely, we can maintain it. So no need to worry. Okay,
Okay.
thank you, ma'am. So, ma'am, I want to ask more question if you want.
Sure. Go on.
So, ma'am, with whom you are living?
With my boyfriend.
Okay, okay. So, ma'am, they are doing well.
Yes, we're doing it well. We don't have any problem.
Okay, good, good, ma'am. So, are you financial supported?
Yes, yes.
Good. That's good, ma'am. Ma'am, I will ask you some confidential question, which is absolutely confined between us. Can I?
Yes, sure.
Okay, ma'am. So, ma'am, do you drink or smoke?
No, no.
That's good. That's good. Ma'am, do you have any concern?
My concern is if my HIV is positive, what
Mhm.
will happen next?
Okay, ma'am. If I'm going to do some test, blood test regarding HIV. If blood test will is negative, then I'll waiting for another blood test after 3 months. Okay, and after 3 months, or if blood test is negative, then I'll start as soon as possible a prophylaxis regarding HIV. Okay. So I'll give you for
Okay.
medicine for 1 month. It would be prevented. It would be preventable by this medication. Are you getting my point, ma'am?
Okay, I got it. But if
Okay.
I develop the sometimes HIV positive, all the symptoms as the
O-
patient used to have, so
o-
what will do in that at the time? Because it's confidential. I
Okay.
don't want to make my partner to know about that. So how can I minimize this if I develop AIDS? My symptoms, how can be minimized?
Okay, ma'am, I got your point. I appreciate your concern, ma'am. It is appreciable that if we are excluded but diagnosed, you are HIV positive, so we can start early treatment, and by treating you as early, we can prevent the HIV related complications. So it would be better for us. Okay, ma'am.
Okay, okay.
So, ma'am, do you have any other concern?
Oh,
Okay.
okay.
Thank you, ma'am. So, ma'am, today in our discussion, I just summarized in our total information regarding with you that you have a history of HIV, you have a history of needle stick injury with a known case of HIV patient. Okay, so in the time I'm doing going to do some blood test regarding HIV. If HIV is sometimes HIV test will be positive or negative, false positive or may sometimes false negative. So, ma'am, if I found that HIV test is negative, then I will do another test for you after 3 months for your confirmation. If test is positive, then I will start you a HIV prophylaxis treatment for your infection. Okay. So, ma'am, then I refer to you a multidisciplinary team, which is consistent with the infectious disease doctor and social worker or professional worker. Uh, in the meantime, before confirming your diagnosis, if initial test is negative, then I'll refer you and inform our professional health worker to give you a office word, avoiding any procedure or like that any direct contact with the patient. Are you getting my point, ma'am?
Yes.
Okay. So, ma'am, in this time, before confirmation or if test is negative, in this time you can practice a safe sex or safe intercourse with your partner, and to minimize the to assure from partner from HIV infection. Okay.
Okay.
So, do you have any concern, ma'am?
No.
Okay.
No. Okay.
Thank you, ma'am. And ma'am, I also give you some leaflet and website link to get more information regarding this condition. And ma'am, I'll give you our hospital number. If you feel any queries or if you feel any worries or queries, you can call us. Are you getting my point, ma'am?
Okay. Okay.
Okay. So, ma'am, may I know how much did you get from our discussion today?
I have got HIV positive needle stick the injury, and but HIV positive needle stick injuries from the infected from this the injury is very low,
Yeah.
but for that still I have to do some of the HIV test, and
Mm-hmm.
for this the HIV test I have to sign in the consent the paper that I agree that I'll do HIV test. And
Mm-hmm.
if the HIV test is the positive, then you will start another treatment. And
Yes.
I need to change some my lifestyle, the modification according to
Yes.
my work.
Mm-hmm.
That this is the infection from me. It's not going to be spread to the other the people.
Yes,
Is
yes,
it?
yes, right.
Okay.
Okay, okay, ma'am, that's good. Ma'am, anyone to drive to your home?
No, no, no. I'm okay.
Okay, 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 ma'am. Okay, all the best, ma'am. Thank you. Okay, good. আচ্ছা, ফ্যাক্ট ইজ আপনি যেটা বলছিলেন, হ্যাঁ, লাইক হচ্ছে যে পার্টনারের সাথে যদি ওই করতে চান, মানে রিলেশনশিপ
হুম।
কোর্স কন্টিনিউ করতে চায় পেশেন্ট, তো এখন ওইটা কিভাবে কি বলবো?
ওইটা হচ্ছে ভাইয়া ওর তো হচ্ছে যেগুলো কমিউনিকেবল স্পেশালি হচ্ছে যে
হ্যাঁ,
HIV হেপাটাইটিস বি
হুম,
ওইগুলো হচ্ছে কি ওই পার্টনারকে জানাইতেই হবে। আপনি হচ্ছে ও মানে আপনার কথাটা ঠিক আছে যে না এটা কমিউনিকেবল ডিজিজ এটা স্প্রেড করতে পারে এটা, তো হচ্ছে আপনি ওইভাবেই হচ্ছে বলবেন যে হচ্ছে লোক I know you have right now your condition you're in very the stressful the condition and it's a very the sensitive things for you. But from the needle stick injury, I already told you there's transmission of the transfer is very the low. But still, if you have the HIV the positive, it's better to know that. Let your the partner to know that you're the HIV the positive, because many the patient they can the living their congenital life, but you
হুম,
know there is a some with the barrier method, some the protection you need to be it is used. And if you have the understanding, it is a very good understanding between the partner, your partner the must be it is supportive for you. I believe that you have any the problem about this that consultation with your with the partner, we are all here to help you. we can arrange another meeting that you are the partner and you, and between us there will arrange the conversation, and
হুম,
I will make him to understand all the matters. That will be the more the easier you and for your the partner. Are you getting me?
হুম,
তারপরে যদি বলে যে না 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 এটা সম্ভবই না,
এক্স্যাক্টলি,
আপনি
হ্যাঁ।
হচ্ছে হসপিটাল থেকে পরে হচ্ছে ওর পার্টনার একটা কল দিবেন, বা
হুম,
হচ্ছে একদম আননোন নাম্বার থেকে ওরে কল দিয়ে হচ্ছে বলবেন যে এরকম একটা সমস্যা হয়েছে, বাট এইচআইভি পজিটিভ আসার পর, রেজাল্ট আসার পর।
হুম, হুম, হুম। আচ্ছা, আচ্ছা, বুঝতে পারছি। ওকে, দ্যাটস গুড। হুম, ওকে।
আচ্ছা, এটা একটা। আর ভাইয়া আরেকটা কথা,
আচ্ছা, হ্যাঁ।
ওকে তো হচ্ছে আমরা প্রোফাইলেক্সিস তো হচ্ছে উইদিন 1 আওয়ার্স এর মধ্যে অথবা অ্যাটলিস্ট হচ্ছে 72 আওয়ার্স এর মধ্যে স্টার্ট করতে হয়।
হুম, 3 দিনের মধ্যে শুরু করতে হয়। সো
হ্যাঁ।
এটা হচ্ছে আপনার ওই, হ্যাঁ, 72 আওয়ার্স এর মধ্যে শুরু করতে হবে যদি পজিটিভ হয় আর কি। অ্যাজ সুন অ্যাজ পসিবল শুরু করতে হবে।
আচ্ছা ভাই, এইটা একটু হচ্ছে আমাদের দেখে নিতে হবে, এটা কি আমরা অ্যাজ আর্লি এজ পসিবল মানে আসার সাথে সাথে 1 ঘন্টার মধ্যে স্টার্ট করব, নাকি রেজাল্ট আসার পর?
আচ্ছা, এটা হচ্ছে
আমার
গিয়ে
যতদূর মনে হয় কি ভাইয়া, যে ওরা মনে হয় আসার সাথে সাথে লিস্ট 1 ঘন্টার মধ্যে, মানে 72 আওয়ার্স হচ্ছে তো লিস্ট, আর মনে হয় অ্যাজ আর্লি এজ পসিবল যদি 1 ঘন্টার মধ্যে স্টার্ট করি তাহলে হচ্ছে ভালো, মোস্ট প্রবাবলি।
হুম, এটা দেখতে হবে, শিওর হতে হবে। এটা কোথা থেকে শিওর হব? এটা তো ই তো পাস মেডিসিনে তো এরকম পাই নাই কোনো ইনফরমেশন।
আচ্ছা আচ্ছা।
আচ্ছা, আর কিছু অ্যাড করা যায়?
আর কিছু না, মোটামুটি হচ্ছে সবই হচ্ছে টাচ করা হয়েছে। প্রেগনেন্ট, আচ্ছা, ওই প্রেগনেন্সির সময় হচ্ছে আমরা একটা প্ল্যান প্রেগনেন্সি করতে হবে, কারণ আমি যে অ্যান্টিভাইরাল গুলো স্টার্ট করবো প্রোফাইলিক্সিস হিসাবেও, ওইগুলো
হুম,
হচ্ছে কোনটা ট্রান্সমিশন হচ্ছে হয় ফিটাসে, ওইগুলো আমাদের দেখতে হবে। প্ল্যান্ট প্রেগনেন্সি হবে আফটার কনসাল্টিং উইথ ইউর ইনফেকশাস ডক্টর অ্যান্ড গাইনি অ্যান্ড অবস ডক্টর।
স্ট্রাকচার, ওকে, ফাইন। হুম, রাইট। ওকে, আচ্ছা, ঠিক আছে তাহলে। আর কেউ আসছে কি?